Welcome to HairMD. Today we will discuss about FUE hair transplant. Hair transplant is nothing but a redistribution of hair. In a bald person, when he loses his hair from top of skull, then in those patients, from same patient, his own hair we take from the area which do not lose hair, or the area which is having permanent hair which do not depend upon the hormonal effect. So especially in a bald patient, the area occiput, side of scalp, these hairs are thought to be permanent hair which do not lose in the bald patient. So in those patients, we took hair from this permanent zone and then we transplant them on the baldness area. This is simple definition of hair transplant. Then what is FUE hair transplant in a bald patient? When instead of taking a strip from this permanent zone, occiput area, we take individual single hair follicle separately and then we transplant it to the baldness area. So FUE hair transplant, FUT hair transplant, these are the two different methods by which we can harvest the grafts. That means by which we can take the hair from donor area. These are the two different methods by which we can take the hair. In FUT, the strip is taken and every hair is separated outside the body. But in FUE method, every hair follicle or follicular unit, it is separately removed with the help of different types of punches, different motor, and with that every single follicle is taken and then it is harvested and then it is planted on the baldness area. Then what is peculiarity of this FUE hair transplant? Why it is becoming so popular nowadays? See, FUE hair transplant nowadays, it is increasing. That means majority of patients prefer FUE hair transplant than FUT hair transplant because there is no big linear scar and patient friendly procedure. Patient can go next day to the work. So it is patient friendly and demanding procedure nowadays. In FUE hair transplant, we can do thousands of hair follicle graft. For FUT method or strip method, there are limitations of the graft to be in. Either 2000, 2500, max 3000, 4000 grafts. We can't take in a single sitting more than 3000, 4000 graft from FUT method. If we try to take more than this, then a big scar will be there and chances of hypertrophic scar are more. That's why in hair transplant, where requires a large number of hair follicles, in those cases FUT is not possible. Especially grade 4, 5, 6, 7, in those cases where demand of graft is more than 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, like that, then FUE is the method of choice. And in this FUE method, simple calculation we can remember. See, on our skull, around 1 lakh hairs are there. So out of 1 lakh hair, this bald area, it contains around 75,000 of hairs. See, in Asian or Indian people, around one follicle, it contains around 1.8 to 2 hair per follicle. That means the bald area contains around 37 to 38,000 hair follicle. And the remaining area, which is thought to be permanent area, permanent zone, here usually 25,000 hair are there, so odd about 12 to 13,000 grafts, follicular units are there. A person looks bald when he loses more than 50% of hair. So from this donor area, we can't take more than 6,000 follicular unit. So in a follicular unit hair transplant, from back or permanent zone, we cannot take more than 4,000, 5,000 or 5,500 grafts. Then from where remaining grafts can be taken? In FUE, advantage is that when there are a large number of grafts are required, then we can take body graft where we cannot do FUT. Suppose if we want to take body graft from chest, axilla or any other part of body or beard area, which is mostly preferred, we cannot do FUT method because we can't take linear scar and we can't take in linear fashion and do outside body graft separation. So FUE is more preferred, and in such cases, after taking these grafts, usually in FUE method we do two different things are there. One is harvesting graft, either from occiput area, body graft from beard area, chest, axilla, pubic area, or other body parts where they are having excess hair. So we took graft from that area and they are transplanted on baldness area where pre-made slits are commonly used. What do you mean by pre-made slits? See, hair transplant is harvesting graft and putting graft to the bald area. So pre-made slits, we make it. It makes your hair direction, hair density, hair curl, and angle of hair. We decide before transplanting. That means it is decided by consulting dermatologist, consulting surgeon. It is decided before transplanting. It is not decided while transplanting. So to have a natural looking hair transplant or natural look after hair transplant, we have to design hairline properly. Hairline is designed according to that patient's need of graft, according to degree of baldness, according to the age of patient, and importantly, how many grafts are available. Then accordingly, we design hairline which will suit to that person, and then after designing hairline, we make slits. These slits are done according to the area. Frontal line, very minimal angle is there, and the hair falls in front and then comes out. So very minimal angle, 15 to 20 degree, 30 degree angle is there. Then slowly we make the slit in such a way that it will form angle which will go on increasing. So after making these pre-made slits, then grafts are harvested with the proper mortar and punches. These punches are important because if we don't use sharp punches, then chances of damaging graft and chances of having scar will be more. So prevent that, we use sharp punches, proper motors, and proper magnification is important. Then after harvesting those grafts, there should be no root touch technique. What do you mean by no root touch technique? See, delicate part of hair follicle is bulb and bulge, which contains maximum stem cells, which contains the hair root contains maximum stem cells and bulge contains maximum stem cells. If we handle them, then those stem cells may be damaged and those damaged hair may not grow properly. That's why while handling hair, there should be care should be taken so that there is no damage to bulb and bulge. Then properly we in FUA hair transplant, we inspect each and every follicle to know how many hairs are there in that follicle, whether anything damaged, and without handling the bulb and bulge, we store that follicle in a 4 degree Celsius saline solution. Immediately in left lateral and right lateral position, we do direct hair transplant. That means immediately after harvesting, uh, graft is examined, and immediately while taking out the graft, majority of grafts they are put inside in those positions, which is called as direct hair transplant. With this direct hair transplant, we reduce the time, out of body time of the graft, so graft grows properly and chances of damage to grafts are very less. So accordingly, the way we put our slits, those grafts are put inside, and then important thing is how to harvested graft, how to put inside. We use proper patented implanters, and in those implanters hair are put inside and then only glide into the slit which we have made, and the technician which put that graft inside the slit which is made by doctor, decided by doctor, and we decide hairline with discussion with the patient. So the hairline will be natural looking, the hair they will come out with proper angle, proper density, proper curl, and that will lead to natural looking hair transplant, and hair growth will be good. More than 95-98% of hair which are transplanted will be grown with this no root touch technique or direct hair transplant technique. So all this procedure is done under local anesthesia. Not only local anesthesia, but there are blocks. We can say supraorbital block, then temporal block, occipital block. So very few injections, 4-5 injections are given, and whole scalp becomes numb, and you can do hair transplant. Patient is totally enjoying the procedure. He is totally awake during the procedure. He can talk, he can listen music, he can read the book, and it is literally painless procedure. Only while giving the local anesthesia in the form of blocks, it is very minor and bite like pain or only tingling sensation is there. Remaining time it is painless. Patient can go to home. Next day also he can come. He can have another session, and it is patient friendly. He can drink whatever drinks he wants, tea, coffee, cold drinks. He can have any food he wants. He can watch TV. He can enjoy the music. He can have talk on telephone. Anything he can do. Even after going to home, he can watch TV. He can enjoy family functions and everything. Even beauty of this FUE technique is that next day he can go to work where he is working, or he can enjoy whatever work what he is doing. Only care is taken that this graft should not be damaged with physical handling. He can use cap. He can go outside. While he is in house, no need to use even cap also. So like that, FUE is one of the better method of transplanting hair or redistribution of hair. We can say this is the proper and latest technique which is used all over world, and now it is becoming more popular than FUT. FUT is nowadays becoming absolute, or you can say patients do not prefer all over world. Very fastly this FUE method is going, and believe we are doing more than 5,000, 6,000, 7,000, 8,000, 9,000 FUE graft. Even we have done more than 10,000 FUE graft successfully in a single sitting of 2 to 3 days in our clinic, and we have grown those here. We have done more than 10,000, 15,000 FUE graft in couple of sittings. One sitting now, suppose, and then another sitting after 6 months to 1 year time. Now with FUE, full coverage of grade 7 baldness or totally bald person can even now imagine that he will have hair. And yes, surely in HairMD, we are giving that type of results. Patients are happy, it is patient friendly procedure, and we are delivering world's best results in a natural looking form. I think FUE is the future, FUE is present. Yes, previously hair transplant used to be failure, but it is at inexperienced hand. We are doing this, we have done, we have made it successful, and we have given it a different look for lot of patients. More than 500 to 700 patients who are happy. We have done FUE in them, and then they are happy and they are living happily. So FUE is possible. Natural look hair transplant is possible. Whatever grade hair loss is there, whatever grade or whole baldness is there on the scalp, yes, you can imagine for your scalp with full of hair. Thank you very much.